I would like to invite on stage my new friend, your new friend, Mr. Daniel E. Chartock, co-founder, COO, and CTO of the BigPicture Health, Inc., to start the session. Please welcome to the stage, guys. Come on up. Did I say your last name right? I'm not fired? Okay.
All right. Good afternoon. Oh, come on, there's way more people in here than that. Good afternoon. Awesome. This has been, at least for myself, and I could speak for a lot of people I've had the pleasure of speaking with, an information-packed week. And that's a really, really good thing. From my perspective, one of the things I heard over and over and over again was all of the different ways we're trying to solve a lot of different problems that exist in the healthcare system and in the healthcare journey, with mental health, with systematic issues. I think Dr. Silva, who we just had the pleasure of hearing from, gave a phenomenally empowering speech. And all of these things play into the ultimate arc that makes our healthcare journey. And so I'm going to take a little bit of time to speak about that today, because from our perspective, we believe we're on the forefront of modernizing the next step. And so, as you just heard, my name is Daniel Chartock. I'm the co-founder, COO, and CTO of the BigPicture Health. We are developing and releasing a platform that we believe will empower America and the world to become better stewards of their health. Now, I'm in a very unique position. I'm also a co-founder and partner at Tag Collective, which is a very modern marketing firm. And the reason I bring that up is of infinite importance as we look at how we redefine each of our individual relationships with our own health. See, we're very good at being told how to do things. Watch the TV, binge watch Netflix, but we're not very good at being told how to deal with our own health. So, let's start with the genesis of where this entire conversation came from. Healthcare expenses are bankrupting the US economy, and this is even before COVID took over. We knew this was a problem. Why? Because there's so many loops in the road, and let's be honest, nobody does anything until it's too late. But the real genesis of what we're looking at today begins with chronic disease. And so a little bit about this project. When we started, my partner, who co-founded this with me, his initial idea was we need to build a platform to help America beat its chronic disease epidemic. And in fact, chronic disease in America accounts for 90% of total healthcare costs, almost $2.5 trillion a year. 81% of hospital admissions. It accounts for 91% of prescriptions and 76% of doctor's visits. And when we're talking chronic disease, we're talking obesity, complications of smoking, we're talking about diabetes, we're talking about heart disease. All of those things that are very much in our vernacular of, oh yeah, I know somebody who has that. 90% of our healthcare costs are driven by that. And so with that comes the other side of the paradigm. Health literacy, it's low. 36%, more than a third of adults in this country have either very basic or below basic health literacy. I think some of the smartest people in healthcare have been in this room this week and had, oh wow moments. Imagine how the rest of the public is with understanding their healthcare and what that means. And of course, the cost of low healthcare literacy has contributed to almost 17% of healthcare expenditures. So over $500 billion alone just on that. And again, these statistics are pre-COVID, but that low health literacy led to a 36% increased risk of death, an early death. All because we're not looking at preventative measures. And so I think everyone in this room will agree with what we talked about earlier, that the patient journey is broken. And actually, in listening to this week, I wanted to redo half the slides in this deck, because I think the fact that we look at healthcare as a perspective of only when someone becomes a patient is half the problem. We all need to become stewards of our own healthcare, and if we're only looking at healthcare as a function of once we become a patient, it's a problem. But the fact of the matter is, the journey is broken. 9 out of 10 Americans do have access to health care. We see them maybe 4 times a year across the different spans of doctors that we see. And yet, the health outcomes that we see in this country are completely disproportionate to the amount of money we spend trying to mitigate those. $2.5 trillion on chronic disease alone. And you know what the craziest thing about chronic disease is? A lot of it's preventable. And it's leading to us spending a terrific amount of our GDP, $3.3 trillion as of 2019, I believe, just on healthcare alone. So think about it. If you were to pick 1 out of every 5 people in this country today, their entire existential presence is a function of healthcare. 1 of every 5 people. Just spending, spending, spending. And it's the most per capita in the world. So how do we fix it? How do we get down that rabbit hole? Well, we got to examine it. And if you remember, I said earlier, I wear 2 hats. I have the pleasure of being involved in this project and being able to help develop this really exciting, what we believe is going to be a revolution in self-accountability. But also, we have to look at what systems we put into place. And this has been something we've discussed a lot this week on how all these disjointed systems are here. They want to help. We have EHRs, we have this, we have that, we built an app, we've done that. But the problem is, it's a patchwork. We have a patchwork of systems. Nothing communicates with one another. Information gets lost in the process. Data is not secure. Data is not integral. All of those things contribute to a really big problem. A lot of patients anxiously await on their doctor when they get results. I can say for myself, you ever go to the doctor and you're just sitting there like biting your nails or aggressively being on your phone because you don't know what they're going to say? Am I dying? What's going on? It's true, though. And let's be honest, especially post-COVID, our healthcare system's been overwhelmed. There is no way a doctor, I mean, some are really, really good at it, but there's no way a doctor can capture every detail because guess what? Unless your doctor is your wife or your significant other or your personal assistant, who spends more time keeping track of every metric in your daily health than you? And we'd be surprised how many data points are lost just waiting to see the doctor. Oh, well, what's wrong? Oh, I feel sick. Well, what happened before? Well, I don't really remember. What would you eat last night? I think I had meatballs. We're missing all those points. And all of those points, you heard earlier today, we talk about the importance of gut health, the importance of mental health. All of those are components in our healthcare journey. And sadly, the most important thing, and this dovetails with what Dr. Silva was saying earlier, the most at risk for chronic disease don't even have the same level or frequency of access to healthcare. They just don't. And it's a problem. We also know the journey is long, right? How many people got sent back and forth, going multiple sources? 8 years ago, I hurt my back. I was pushing my Monte Carlo up a hill. I think that's what did it. Could have been something else. But I hurt my back. Went to go see a doctor. Said, okay, you're going to go need to see another doctor. And that doctor said, okay, you're going to need to get an MRI, but the wait for an MRI is 6 weeks. 6 weeks to get an MRI. This was in New York. So then I jumped across over to New Jersey. If you can't tell, I'm from New York. That's why I talk so fast. It's what we do. It's a New York thing. But anyway, by the time I was done, in the span of 2 weeks, I think I had crunched 14 appointments in. How many people really have the staying power unless they're in a lot of pain, unless they're in that 8, 9, 10, to actually go and follow through with that? And that's part of the broken journey in the healthcare system. We don't want to do anything until it's too late. And of course, we know information's delayed, or we're waiting for someone to release it, right? Every time I had to go to another doctor, they needed the notes from the previous doctor. Well, the previous doctor didn't want to release it. Then I had to go back there and go fill out a release form for them to go and release it because they're in a different system. It's a mess. And so creating a true picture of a patient's healthcare journey often requires the patient to piece it together for the doctors themselves. Every time I go to a new primary, what do I have to do? I have to fill out 30 pages of my health history. How many times do I write, do not remember, do not remember? It's too much to keep track of. How can I remember every disease every family member has ever had? It's just not possible. There's too much. And so what happens? You take blood tests, you get your results, and you feel overwhelmed, right? Either your doctor says everything's okay because it's a point-in-time snapshot. You were good, right? You didn't eat before you took the blood test, you drank plenty of water, you didn't have coffee that morning, and they can't see your entire history and context. So you get a nice, good old false positive. You don't know how to read the results yourself. I've had people come to me, what the heck does this mean? Well, it means you're right at the edge, but if that's a good thing or a bad thing, you gotta wait for your doctor to tell you. You don't know how to make them actionable. Okay, well, my cholesterol is still in the good zone, but it's really close to being bad. Do I need to do anything about it? And of course, you're relying on other people to help you take control of something. And that really brings us to what is the most important question, which is how do we fix this? How do we plug a hole that's been created by a series and by systems that are all looking to help us, but all have their own shortcomings? And so, from our perspective, we need to motivate the user or the patient or every single one of us, right? We need to be accountable for our own healthcare journey. Preventative medicine, great term that's been thrown around a lot. But what is preventative medicine? Well, we built a culture of dependence, right? We rely on our doctors to tell us everything about our healthcare. Now, we're starting to branch out. We're starting to see specialists. We're starting to talk to other people. But oftentimes, a lot of our insurance companies will tell us, well, we can't do that unless that doctor says you can go talk to that doctor. It doesn't help, right? So we have to start teaching people on what really matters. We've started talking about teaching health and financial literacy courses in school. They just started doing those in the last 10 years. I didn't have those when I was in school. I'm sure a lot of folks in the room didn't have those when they were in school, but we started doing it. We need health literacy. We need to empower individuals to be proactive in their own health care. And most importantly, we have to educate patients on the impact of what the small actions do in their bigger picture. Having a salad today may not make me healthier, but maybe if I'm replacing a cheeseburger once a week with a salad, those little actions have a broader impact over time. We have to educate everyone how we can prevent chronic disease by paying attention to all the little things. And ultimately, we need to be our own data analysts. But we're not all doctors, so this is ridiculous. But I'm going to get there. We need to provide them the tools that are going to help them feel confident in managing their own healthcare journey, right? Our banks are doing a great job now at giving us big picture views of our financial health, at least as far as they can see it, right? If I have assets in Bank A and assets in Bank B, they can't see each other, but they each think they're giving me a complete picture. And we need a universal platform that deals with all of these healthcare arms and connects the journey. Doesn't do me any good if I'm in hospital system A and I have a bunch of stuff going on, and then I got to go to hospital system B, and then they got to wait to get the results from A. We're creating our own backlogs and nightmares by doing this. Now, how do we get anyone to do anything in this world? We got to build an easy user experience. Healthcare's hard. It sucks right now if you're the end user. The paperwork, even the apps a lot of these systems have designed, they're getting pretty. With all due respect, they're getting pretty, but what the hell does any of it mean? Okay, great. My cholesterol is 140. Okay. I guess I got to make another appointment to talk to the doctor to find out the information that's in the portal you just alerted me to have, and I got to stress about it all weekend long. And ultimately, we have the technology today to build a seamless user experience that empowers them to pilot their own journey. Now, before the doctors in the room think it's a good idea to start throwing rotten tomatoes at me, they might argue, why not let doctors do their job? And the answer, in short, is they are, and they'll continue. But just in America alone, with 330 million people, you can't be with everyone all of the time. And we've got to start to empower a culture where the user is responsible for his or her own journey, and the doctor is placed back in the position as the subject matter expert. Right? And we have healthcare technologies that we can use to empower that user journey and make the doctor's life easier by providing data points and context and experiences that you may not remember, right? How many of us are wearing a health data monitor? Apple Watch, Fitbit, All of these are health data monitors that give a tremendous number of data points that half your doctors can't even see today, right? We have to remove the barriers that have been created by miscommunication, exhaustion, fear, anxiety, and distrust. How many times have we heard horror stories about folks going to the hospital, and because they're a person of color, the doctor doesn't believe them about what they're going through? We need to break that down. And this, again, I think it was fitting that Dr. Silva spoke before me, because I think so much of that is relevant in all of this. And we also need to do the last thing, which is ensure the right data isn't skewed by patients in an attempt to present themselves as better than they are or worse than they are. We all know that friend who they can take an immense amount of pain. So when they're in pain, their pain's like 100. And then we all know that person that they prick their finger and they're like, oh my God, I'm dying. It's all relevant and relative. And so we've got to be able to manage through all of those different things. Now, why would a patient care? And again, I want to take the word patient out of this. I feel like, especially after everything we've talked about this week, this should just be all of us. It shouldn't be a patient. We want to save the patient time. They're not having to wait for an appointment to analyze data and results. We want to reduce the time spent researching something they misunderstood or developed anxiety over. How many people, the WebMD effect? Either I'm golden or I'm dying, right? One or the other. We've all been there. Holy crap, what the hell is, oh my God. We've all been there because we're all trying to self-diagnose without the right tools. Don't get me wrong, WebMD is great, a lot of information, but information with the wrong subtext or context equals a bad output. And so we need a solution developed with the patient first that has a world-class user experience and workflow. We need to build a suite of tools that allows them to make better decisions towards their health journey. So how do we reinvent it? And so what we've been doing over at the Big Picture is we started with this initial concept of we wanted to build a tool that would help the 90% of the population that's fighting chronic disease have a way to get in front of it without waiting to go to their doctor. Someone who's developing diabetes isn't going to the doctor typically until they have diabetes. Well, how do you manage and get in front of that? And so what we focused on is building a patient-first platform that focuses on ease of use and simplicity that's paired with functionality and intuitiveness. What does that mean? Imagine Steve Jobs came back to us and basically cracked a whip to build an app to help you manage your own health. That's where we're getting to here. It's a platform that's at its core, it focuses on chronic disease management prevention, but has grown to so much more since we began embarking on this project together. It's by its design and flow improves users' health literacy, and it places the user's electronic health records back in the palm of your hands. So instead of the health systems owning every health record, how many of you, anybody in the room watch Seinfeld? Okay, do you all remember that episode where Elaine and the file, and she was trying to get a copy of her file and the doctor just kept writing notes in it? It hasn't changed. We all have health files at all these places, and getting them is nearly impossible. It's our data. It's on us. Why does the system feel that they own it? And so what we're looking to do is be able to put the health records in your hands so you have a complete and comprehensive picture of your health. What good does it do if I have to go 15 different places to figure out what's wrong with me when all the information should live with me in the first place? And so our system empowers users to approach health management both strategically, proactively, and holistically. It creates self-accountability through easy to interpret visualizations of the user's data, and we call it the Big Picture. And to me, that's really important because health isn't any one aspect. Right? We heard over the last several days that health is a culmination of your physical well-being, your emotional and mental well-being, your environmental well-being. And so we started with a core built around mitigating and managing chronic disease. And our team tracked and created what we believe are 12 core metrics that drive the majority of chronic disease in America. And we call it the Wellness Dashboard. And so our wellness dashboard looks at 12 main metrics, including your weight, or BMI, whether or not you're a smoker, because I think we can all accept now if you're a smoker, it's likely to impact your health in a lot of ways, right? Your waist circumference, your blood pressure, your glucose, your cholesterol, your blood counts, your iron levels, your vitamin D, your kidney function, your liver function, your inflammation. 90% of chronic disease is driven by these 12 metrics. And of course, if we didn't make it easy to understand, it'd be useless. You don't need just another place to store data and look at it. I mean, what good is data if you're not a data person? And so we needed to build a tool that made the metrics easy to understand with readings that indicate every value the user adds as green, yellow, and red zones so you can drive appropriate actions across the platform. With those, you're able to view context. So you can open up and see why your blood levels are important, why your cholesterol is important, what are the healthy ranges, and what do those mean? We're giving you context, we're giving you an understanding, and we're giving you an opportunity to proactively take control of your health, not when a doctor tells you to do it, but as early as you want to start your health journey. And of course, as I said, we started with the 12 core metrics, and we said, how do we turn this into a platform that can evolve with everything our users are going to want to be able to do and want to be able to track? And so as we're preparing to launch our MVP in the coming weeks, we've included things like tracking your vitals. I've never seen, in the last year and a half, more temperature sensors and thermometers being sold, more pulse ox sensors being sold in this country. Those are vitals. And imagine if, as everyone was freaking out during COVID-19, you could have been tracking these and keeping track of your journey as often as you wanted to, whether that be hourly, daily, weekly. So if you knew something wasn't feeling right, you could go back and say, okay, look at what's going on here. I can now tell my doctor, you know what, my pulse ox has been funny for the last 5 days, but I didn't really think anything of it because it was like 90, 92, 93, 87, 94. So I thought it went back up. It's okay. We all know COVID struck in very sneaky and different ways. We're going to allow people to track screens and vaccines. We're building a place into the app where everyone who got a paper COVID vaccination card, I'm one of them, you're going to be able to store that in there so you don't have to worry about losing your original card. And if and when that's going to be needed, you're not fumbling for it. It's in your phone that you're already carrying with you every day. We have the ability to track additional electronic health records, and it's something we're expanding constantly. Mentioned the COVID card already, and what we consider one of the best feats of what's going to be coming out is a food dashboard. And I'm going to spend a minute to talk about this because this is something we are really, really proud of. There are hundreds of meal trackers out there that people pay all kinds of money for. Usually your focus is, okay, consume less calories, change my diet. Okay, I want to eat less salt, I want to eat less sugar, eat this, not that. And those are great. But this is better. And this is better because our food dashboard is going to tell you what foods you should be eating so that your metrics that are yellow or red, you're actually building a health plan towards making your body better. If I'm in the red for my sodium intake, it's going to be telling me to stay away from those Tostitos. It's going to. Exactly. And it's going to be intuitive. We've gone in and we've populated, we've made it really, really easy so that you can go in and whether you manually enter your food like a lot of food trackers, scan a barcode like a lot of food trackers. We've connected it to the USDA's database of all the food products in the country. And we're working on really exciting technology that's going to leverage AI where you can take a picture of your food and be able to identify what's in the picture and automatically log this. And what's great about this is we've built in the accountability again. We have a couple of different challenges we're going to be releasing, including one we call the 100-day challenge. Can you eat for the next 100 days in the guidelines of your metrics to help build a healthier version of yourself? I'm pretty sure everyone in this room could do it if you had a little nudge. Well, here's going to be your little nudge. So how this is different, why it's going to work. One of the biggest key differentiators, right? A lot of the platforms are too complex. My background, I told you earlier, I run a marketing firm alongside doing this, but before that I did data analytics and sales. I've done tech. I have touched all these different things. I understand complex platforms, and even I think they're too complex. They're difficult. And I'm not putting anyone down, but if I think they're too complex, having touched all those different arcs, I can only imagine the user with low health literacy. They're looking at it going, no, thank you. Second, the platforms are usually designed to serve a single function. Here's a fitness tracker. Here's a burn calories app. Here's a movement app. Here's a workout with your trainer app. Here's a food tracking app. None of it's bringing it all together. It's a problem. What's going to happen? You either have to sit there and run through different hoops to get there, but you can't action it together. And that's uber important. Now, why will users make the move now? I don't even feel like I need to go over this because I think that so many people in the room over the last 3 days have done a tremendous job at why users are ready to make the move. But one of the reasons I said earlier, technological advances have made mobile and wearable devices more accessible. I have been crossing my fingers for years that Apple finally comes out on the Apple Watch with that blood glucose sensor, that you don't have to prick the skin anymore, that it can sit on top and just measure through your skin what your blood sugar level is. That will change so many lives. It will. Rumor has it this year, but rumor's had it every year for the last 5 years. But if that comes out powered with our platform, that's going to be a game changer for every diabetic in America. And even without that technology, existing technologies will allow those with diabetes to better manage their health and their food intake with our platform. And it'll be a game changer either way. Of course, we talked about this week, the pandemic has accelerated the acceptance and adoption of telehealth and mobile health technologies. Today, we all saw, I think it was earlier today, the video where the doctor couldn't quite get anything through and it was a garbled conversation, and it was hilarious for us, but it's true for many Americans. Even if you do get a telehealth visit, does the doctor really have every data point in front of them? We envision down the road you being able to share your collection of information with your doctors so your doctor can action all of your data, not just the symptoms present in that moment. For the doctors in the room, wouldn't that make a difference to have access to more information much quicker? We know that insurance continues to be a barrier to entry for many to healthcare. My insurance costs have gone through the roof the last 3 years, and it's not because I'm not healthy. It's just because a broken system keeps feeding on itself. New generations of patients are looking to be healthier than their parents. That's just a given, and we've seen the statistics to back it up. And honestly, and this should really be the mic drop right here, having control of your own health journey just makes sense. We talk about accountability. We talk about the importance of taking care of ourselves. But when it's time to do it, how many of us do it? Okay, yeah, I run every day. Great. Oh, I have a salad 3 times a week. But is that enough? For some people, it might be. For others, it might not. And having the tools at your disposal to be able to act on that is of the utmost importance. And with that, I would love to take questions from everyone in the room. Oh, some people are jumping out of their seats. I don't know if that's a good thing or a bad thing. Oh. Sure. In terms of our internal testing, we've tested it with a very limited number, under 100. However, we have a number of case studies that we did even during the development of the app. The app's been in development for over 3 years. And so we've had case studies where folks with chronic disease have actually brought it to a point of mitigating their symptoms. Again, we're not pretending to be doctors here. We're using accepted public health information to help guide folks within that, and we're still expecting people to rely on their doctors, but be more proactive in their healthcare journey.
Fantastic presentation. I'll pass it to you. He gave it to me. So, fantastic presentation. I agree. You sort of mentioned that the patient should be able to have and utilize their own data. So what would your plan be to wrest it from all those people that are making billions of dollars off of the data now? Because we know they are, and the patient is the only one that really can't get their hands on it.
That's a fantastic question, and I love it. And so we have a multi-tiered approach to how we're doing this. Our first iteration, the patient or the user is going to be responsible for entering his or her data. Our second phase is we're going to be looking at integrations. The lovely woman who was here on day one talking about the stuff they're doing with at-home testing, we think provides a great integration opportunity. And honestly, if any of the larger testing companies want to come to play ball, it's a great opportunity to do that. So that will be a piece of that as well. And honestly, we have a right to our information. They can't stop us from putting our information in. We shouldn't have to wrestle it away. And the fact that we even have to ask that question indicates everything wrong with a broken system to begin with. We do hope to partner with doctors down the road. We believe there's a lot of opportunities to expand this in ways that this could become its own ecosystem. And doctors or trainers or other people could build on top of this. Imagine your personal trainer being able to build you a health plan based on the chronic diseases you're potentially prone to. That's the future we're envisioning with this platform.
Do you today pull data from other EHR systems, or is it all patient-entered?
Everything is user-entered today. And one of the most important things we want to ensure is, number one, the security of our users' data. Everything we're doing is HIPAA compliant. Everything is done with end-to-end encryption. It's something we felt was very important, but we're looking at even bigger approaches down the road. Another thing we envision down the future is imagine traveling abroad and having a medical emergency. Imagine we're able to encode, without any PII on the blockchain, your entire user history for a medical emergency, and somebody can scan a QR code in your phone. And a doctor in another country can have a version of your medical history in a language they can understand. That's some of the potential impacts we see with this. And so yes, long answer short, today it's on the user to enter, but our hope is as we release this into the wild, the interest amongst the users will drive the desire of adoption amongst the people who are creating the data in the first place, whether that's doctors, labs, or anyone else.
So, but the problem is still the Epics and the EHR systems of the world who hold the data, right? So that's the problem.
They are, but the user is still being given the data at some point. And so what he or she does with it, we think this is the first step. And then, can we build secure exchanges to take in that data? Absolutely. And that's something we want to look to do. And if you have any partners who are ready to do that, I'm happy to have conversations right now.
We've tried this before, but we're way ahead. That's why I was just asking the question.
No, of course. And that's fine. If they want to continue to be resistant to allowing users to have access to their own information, that's fine. You know what's going to happen? There's going to be labs who are going to pop up, and people are going to migrate to those. It becomes a question of their own existence, because when you empower someone to do something for themselves, why would they go back to allowing someone else to control it? That's the next thing we need to invent, a drone that has the microphone that can fly over quickly.
Right, right. So this is probably a very loaded question, but I think you mentioned it a bit, but what, in your eyes, is one of the biggest issues in healthcare that we're facing now? I know it's a loaded question, but...
It is a loaded question, because I'd be remiss to say that just what we're doing is it. There are so many issues from my perspective. I think the first being health literacy, especially in our less affluent and poorer communities, is a problem. And they're trained not to go to the doctor. Or they go to the doctor when it's too late. And we've got to find a way to break that journey. And let's be honest, everyone seems to have a smartphone today. So why not break it at the source and give them the tools to at least start on that journey before they've stepped off the cliff? You don't wait till someone's completely blind to get them a pair of glasses. Any other questions? Well, awesome. Oh. Absolutely. Well, I think that that's a multi-pronged question, and I think it's going to depend on a lot of different factors. I think there's opportunities with grants and public-private partnerships that we can delve into. I think there's opportunities with being able to just educate in general. And the first step to fixing any problem is admitting you have one. And this is, from our perspective, we have a problem with chronic disease in America. We have a problem with health literacy in America. Let's start giving people the tools to push back. And then, of course, as everyone agrees in here, we have a problem with big data controlling our health data and not giving it to us. Let's push back, and let's get in control. Thank you, everybody.